Finished? 2 rows. Where we play in rows like these things. So this is the Afghan catfish. So main similar task there, but with your knowledge from your previous topic. Okay? Let's start. You have 2 minutes and 2 teams. First, blue one, first team, and red one, second team. Okay? You need to answer. There will be options. You need to answer for the correct, and you will answer. After that answering, you need to go to the back. And next students will come. Okay? Everything is clear? Come. Yes, come and answer. Step by step. Change the place faster. You have only 1 minute. Don't answer. Change the students. Yes, go to the back. Don't answer, please. Don't have with your next student. So 30 seconds left.
Middle. First. 18 cells.
15
Middle.
seconds left. Speak English. Sing yourself. 4, 3, 1, 0. Time is up. Let's see the winners. The blue one. Who was the blue one? Yes, you won. Okay? Please, you can sit. Okay? Please sit in your chairs. There? Fighting. Okay, what kind of management you need to take?
First aid. Hypocritic method, we want to first do the patients.
Okay, what the person can got after the trauma? Nasal obstruction. Problem with breathing. Epistaxis. And then nose deviation. So today we will discuss about epistaxis and deviation of nasal. Okay, thank you very much. Sit down, please. So, as you know, this is very actual topic. Thank you. So, let's start with our So, you found today's topic, you were through, and look at that pictures, what you can see. This is the endoscopic picture of the nose, yes? And you can find the normal picture and some problems. What do you see there? Okay, that's good.
And hypertrophy of the inferior cortex.
Yeah, hypertrophy of middle cortex. So about today's topic. So by today's topic, we have some goals, outcomes after the learning. Yes? And can you please read the first one?
So first is diagnosis type of deviation, symptom based on the data from the anterior rhinoscopy and CT.
Okay. Second, your goal by today's class.
Classifies nosebleeds by the location anterior and the posterior.
Okay, classify. And third one, please.
Find the Kesselbeck zone, explain the technique of anterior tamponade.
Okay, and fourth one, start please.
Justify the treatment tactics, conservatives of the surgical treatment,
Okay.
septoplastic conversion.
So after our class, you need to take all of these goals, okay? By make these goals, we will make some exercises to reach that goals, okay? Now I'll give, you have divided, right? Divided. So now I'll give the task. So this is case number 2 and case number 1. So if you can see, we have the quadrants. Do you see the quadrants? So this is the quadrants evaluation. How will I put the points for your task? Okay. This is the criteria. Okay. And this is the points. For example, if you will put correct diagnosis, preliminary diagnosis, you will get 1 point. Half, 0 point. No diagnosis, 0. Okay? So total you need to get 4 marks. Clear? Read, first of all, read the criteria. Read the criteria.
जो पहले डिवाइड हुआ था समझ नहीं डिवाइड हुआ था
Please speak English. So everything is clear about this evaluation of criteria. Or you have questions?
Guys,
For example, for the task number 1, we have some criteria. For example, to put correct diagnosis. And add what kind of examinations you need to add in your case. Third one, your correct treatment. And fourth one, your team work. So by these criteria are good points for each group. Clear? And second one, yes, this is your criteria, okay? What kind of, you need to find what kind of nose bleeding, your acute situation, your first help, okay? And how to make posterior tamponade, and your clinical resourcing, okay? If everything is clear, knock with your hands or heads.
If we cannot find the localization, if we find the localization, we use cauterization. So first we will use and Then after the composition, we will try the other and then we will
Okay, time is up. Please proceed. Please guys be active and we have a short time. We have to finish on time. That's why please hurry up. Stand there. Yes. So look at who is with where is your yes. Okay, look at them. You have a task. You need to check them. If they will ask not correct answer, you need to yes, correct them. And you can get extra points for their mistakes. That's why pay attention. Okay? Let's start.
A 70-year-old patient was admitted with active bleeding from the left side of his nose. He suffered from hypertension. Current BP is 190/100. At home, he tried to stop the bleeding with hydrogen peroxide, but it was ineffective. Examination. On examination, we found a scarlet stream of blood flow down the back of the throat. Anterior rhinoscopy does not reveal the source, like the flashback area is dry. So, determine the type of bleeding.
So first of all, we will look at what kind of signs we can see. Age group is the first factor. Here we are seeing that the patient is elderly, not younger or young adult age group. So that is also one of the things that we have to take under consideration. Second, the person already have the problem of hypertension. And hypertension is also one of the prominent cause of elderly people having disorder of nose bleeding.
Okay.
So this will...
By the way, I put time.
Yes.
Okay.
So this will show that the person have posterior bleeding.
Okay.
Yeah.
True? Yes. Okay.
Second one, what is the physician sequence of action?
Okay.
Okay. You have a posterior bleeding. Okay. How you need to help to that patient?
Okay, so the patient is there is a posterior bleeding from the pharynx, you can see. So in this case, first we will need to suction out all the blood from the nose through the suction tube, and then we will check for the sign of bleeding with endoscopy, nasopharynx endoscopy, posterior side. If we can localize it, we will use cauterization to close off the wound. If we cannot localize it, we will use your posterior packing or posterior tamponade.
Yeah.
Okay. Next.
Describe the posterior tamponade technique.
Okay, so the posterior tamponade technique it is used for the posterior epistaxis only. Okay, here when the posterior packing, this packing has the 3 silk ties, one like this and one is like this. These 2 ties goes to the posterior side of the epistaxis, posterior side of the nasal, and the one is outside the mouth. Which if that is soaked up, then we can pull that with third tie. Okay, and so this requires hospitalization and under the condition of the anesthesia.
Okay. And what about your additional I gave for you? Yeah. By straight. Was it something wrong or not in your mind? Okay, the person has a sinusitis. Okay. And endoscopy? That was your thing. Okay. So, did you find the mistakes? No? Okay, please change them, please. So you have 2 tasks. Second case number 2, you have 3 tasks. First task, also you need to check them. Okay, find any kind of mistakes. If you will find, you will get also instructions. And second, You need to check yourself by these criteria. Put for yourself, for your team, your point, from your opinion. Okay? Okay, let's start our timing. Okay, start.
A patient 24-year-old complains of persistent left-sided nasal obstruction, recurrent headaches, and frequent left-sided maxillary sinusitis. In childhood, there was a history of nasal trauma fell from the trauma suite. Examinations. The nasal dorsum is deviated to the left side. Anterior rhinoscopy and the nasal septum in the bony portion has an S-shaped deformity. And on the left side comes into contact with the inferior turbinate on the right side. Compensatory hypertrophy of the turbinate is observed. The task is establish of a preliminary diagnosis.
I decide that the diagnosis is a paradoxical nasal spectrum because here the pain which are in the left side, but the inferior turbinates are presented at in the right side. So if the paradoxical, the clinical features, the obstructions are in another side, but the main problems in that other sides are there. So let me see here, it is an endoscopic, I will show that. Here it is the inferior turbinates get to be bulged, that's why they are having the pain. So I will be examined, it is an paradoxical sinus.
So your preliminary diagnosis it is?
Paradoxical deviated nasal spectrum.
Okay, by classification, which shape?
Which are the S-shaped paradoxical sinus.
S-shape or? Yes.
So it is get bilateral obstructions are there.
Okay, we argue for your diagnosis. Yeah. What kind of argue you can make through the history or during the examination?
Okay, first I will be prefer that the patients to the anterior endoscopic to them because they having that pain in that right side. So I will be do that.
This is your first argue.
Yes,
And
ma'am.
second argue from the anamnesis history. So the person, the patient has
Fell
Fell
from
from
swing.
he got trauma.
Trauma.
Okay, this is your second
Second
argue.
diagnosis.
Okay. For the next question.
Next question. What additional diagnostic methods would you recommend?
Ma'am, the current diagnostic method we have already performed an anterior rhinoscopy. So following this, we will perform a CT scan to get a better imaging of the deviation in the septum and also to better understand the hypertrophy on the right side.
Okay, where is your imaging? Did you check
Yes, ma'am.
what word they are taking? So, what kind of diagnosis is it?
Ma'am, we have seen this and it only, we agree with the preliminary diagnosis that there is a left side septal deviation and on the right side there is hypertrophy.
Can you say the name of diagnosis method? There.
CT
scan. No, it's not correct because we have some difference. How to find CT scan or is it MRI?
This is
It's MRI.
MRI. How you are saying this? It's MRI.
Ma'am, white will be appearance on
Okay, by MRI you can see just soft tissue.
Yes, ma'am.
Look at there. There is no skull base,
Skull
for
base is
example.
one.
Bone part is absent. Teeth are also absent. So this is indicates, it means you have MRI results. Okay? This is the how to find MRI or CT scan diagnosis method. Is it or not? Okay? Next question.
Which surgical intervention is indicated?
Ma'am, the first one, there are two types of surgical intervention we can give. The first one is a septoplasty, where we give the additional skin like perforation in the nose and give the mucosal lining. And then the second one is surgical intervention is some mucosal recorrection surgery. But some mucosal recorrection surgery is very performed, and the septoplasty can lead to the higher complications of saddle nose and destruction of nose also.
Okay, main treatment in the septum, you need to Only surgery treatment. Yes. Why you cannot use, for example, drugs or nasal sprays in this case?
Ma'am, because there is a septal deviation and cause a hypertrophy in the patient, and if we give the drugs, then it can lead to various more complications in the patient.
Okay, so and by the way, this is the deformation of bone part. Bone part you cannot use any kind of drugs will not. Okay? Last question. Your time is up.
Explain the mechanism of compensatory hypertrophy on the lateral side.
Ma'am, compensating hypertrophy mechanism is because there is a bony deviation septal part in opposite side. So there is opposite side of nostril which are performing very well. They have to compensate for extra working, and due to that, for the extra continuous working, there is a hypertrophy, and the maxillary sinus infection has also been increases, and therefore the last option is also given to the patient.
Okay, that is true. Look at this picture. So this is your case. Show to the second team too. Have you finished? Yes? Okay, sit down please. And put for your team your point, okay, by these details. So let's discuss your task about the division of nasal septum. So by endoscopic photographs, you can see the spikes. Yes, normally the nasal septum have to be straight, and there is have to be no spikes and ridges. So look at these pictures. We have the left side of the nose, and there deviation of right side. Okay. So look at this picture. This is the answer for your last question, why we have hypertrophy of the wall of the conhas when we have deviated of nasal septum. This is our deviation septum. Normally it has to be straight, right? Yes. And during that time, we have on the right part, like this case, and left nose looks like this one. Why we have hypertrophy? So it means, let's take the case from our nature. For example, imagine we have two grounds. One of the full of the trees, flowers, it grows there. And second one is no. So why during that time all of the trees grow to that empty place and will full of flowers. That in our organisms we have that cases. And there will be in nasal cavity too. And about the how will you put diagnosis? You need to use CT scan. So do you see the bony part is white color?
Yes.
Yeah. So do you see the? So normally it have to be
Straight.
So what is this?
Inferior.
Yeah. Okay, superior it's not because they are short and located deeply. Okay, about your treatment, how you need to make treatment. We have two types of surgeries. Resection according to the cilia and the spinal septoplasty. Main difference when you are making first method, you are removing all of the cartilage part. If you will remove, we have some complications. For example, yes, for example, your tip of the tongue can down. Okay? That's why we need to remove only spikes part. And make straight and put again. This is main difference between spinal septoplasty and resection according to the theory. Okay? About the second team. Let's start from your bleeding. What kind of bleeding was it in your case? Posterior epistaxis. Yes? We have some methods how to stop nose bleeding. There are anterior nose package and posterior nose package, right? Okay, can you I will show how to make, how to stop nosebleed. You cannot practice in your nose because this is the painful method. So this is the hardest method. That's why we will use our model. Okay? So first of all, you need to take. Can you collect all the photos? Sterile gloves, right? Okay. You need to wear. I guess everyone knows how to wear sterile gloves from surgery subject, right? So you are eating, then so one of the main causes of nose bleeding. What kind of etiology or main causes of nose bleeding? Trauma. Okay, we have local and general causes. Local, there are trauma. Okay. Then infection or the general disease.
Hypertension, coagulopathy,
Okay, tumors of the blood. Yeah. What else also? Okay, we have, if the patient has problems with the thrombocytopenia, disease, liver disease, okay? For that we need to use instruments, some. Okay. Let's see. So this is heart-mouth mirror, okay? As to others, look at that. As to others too. So this is heart-mouth mirror. Second one is bayonet. Yes. So this is there are main instruments to use that. So first of all, you need to find nose bleeding. You have 5. This is the posterior bleeding. You have the anatomic structures. You have known, yes? We have discussed last class about that. So for that, we need to use bandage. What is this bandage? So, still, bandage. You need to prepare. Every ENT doctors have to ready this.
Silver nitrate solution.
No, this is the posterior. So you have to prepare tamponade before. Every ENT teachers have to have in your in their work, okay? Then before that you need to make use. What is this? The congestants, nasal congestants. What do they make?
Free the nose.
So nasal decongestants works for the blood vessels. They are made constrict all of the blood vessels inside the nasal cavity. After that, we need to use yes. S
to reduce the
name.
pain.
No, I am asking the name of.
Xylocaine.
Okay, xylocaine. Other?
And adrenaline also.
No. Lidocaine. Okay? Yes. You have prepared, you have cleaned, okay? Let's imagine normally you need to sit there, make examination, yeah? During this yes. Your position in front of the patient has to be like this, yeah? So it's made to more visible. Let's make like this. So look. You have to every time use how to hold the nasal mirror. Yeah, that's true. So use and you need to open. clean inside the nasal cavity any kind of foreign bodies. You have clean then. Clean oropharynx too. Okay?
Yes.
So for that you need to use what? What is this? No. This is the tube, flexible tube from the needle. Yeah. Okay. So you need to fix. And do you see we have two rope threads? First of all inside. Second one outside. So it has to be two ropes. You will understood. You will understand.
Yes.
So you need to fix with this flexible tube. Why? Why you need to fix?
It should not get away.
Because it will not, if you not fix, it will move out.
Okay, that's true. So how will you work? Throw the nose mirror. You are going throw mirror, okay, from the vestibule. Providing use every time BM forceps, okay. So start from this inferior part of the nasal cavity, okay. You need to go to the nasopharynx. After that, oropharynx. And you need to say to the patient, open your mouth. Open your mouth. You are taking with the forceps through the oropharynx. Okay? Then you need to fix. Can you help? You need to fix cotton. Yeah. Part there. Okay? You have put, after that, second part is in nasal cavity, right? So through the oropharynx, you need to take this tampon and put your tampon where? Where? In which?
Behind
the yes, in colon. And do you see the second part? So you can make what? You need to fix where?
Outside.
Yes. Can the patient cut this thread?
No.
No, why?
Because he will be under anesthesia and in the hospital.
If the patient cut, this is tampon, we can make trachea. Yes, and it will be abstraction, aspiration with
Breathing.
yes, and you cannot remove easily with this thread. Do you understand?
Yes.
How to remove? After 2 days, you need to remove this through the oropharynx. Okay, carefully. You have made posterior tamponade, but bleeding is not stopped. How you need to make? What you need to make?
Ligation of the artery.
What else also? We need to think about posterior part too, because we have two emergency zones. Yes? About Kisselback plexus. Yes? Okay, for that we need to make your second method. Anterior tamponade. How you need to make? So you have to prepare with the bandage roll. Okay? Use the ointment what kind of ointment it can be.
Lubricants.
Any kind of, yes. It will be better if you will use with antibiotics. Why?
Because
decreasing the infection.
Prevent infections. Yeah. So you need to mix. Okay? Mix everywhere. So you have long bandage. So how you need to put, how you need to pack, we have some rules. Through the nasal cavity, you need to go, okay? Yes, and do you see the size of the Beyond Forte? So this size of the nasal cavity, okay? And that will help when you are making tamponade, okay? So you need to go to the posterior part of the nasal cavity, not only upside, not only
Downside.
yeah. You need to be, you are going the, yes, it will be in inferior part of the concha, inferior, yes. And look, you need to take size. So from this, this is your second stair. Look.
Yes.
Okay, the same size. And you will make and complete your middle meatus. During the making, you need to hold with your nose mirror and the tampon too, because it can go to the backside. Okay?
Yes, ma'am.
Again. So this is the very acute situation, because for the short time the person can lose very high blood. Okay? So you have completed. Yeah. You have completed. Then your successfully nose tamponade have some indicators. Which indicators? Your main goal to stop the bleeding, right? So your tamponade will be successful if you will stop bleeding. Okay? Do you understand?
Yes, ma'am.
And how long you can make the person can stay with tamponades?
24 hours.
When you remove your nose, yes?
Yes.
Okay, you need to go through the orifice. That's right. And nose through the vestibule. Okay, from the superior part to the inferior part. Clear?
Yes, ma'am.
Okay, do you understand? Yes. So this is the first method, how to stop. Second method, if you have in modern or more high quality hospital, we have Folaeus catheter. Yes? You can use Folaeus catheter. How will you make? Through the vestibule, through the inferior meatus, you need to go to the choana. Okay? Then you need to use
Saline.
so for what?
For give the
Bulging
air.
of the bulging of the
Yeah. So there is, we have balloon.
Yes, ma'am.
Can you fix it? Okay. I have a ointment on my gloves, that's why. So, do you see?
Yes.
So
Yes.
balloon is
Inflated.
grow. Okay, do you see? And you need to fix. So this model is bigger than our skull base. That's why this is the full place. Normally, if you will give 10 ml oxygen, that will be enough. Okay? And how to remove?
First here.
Yes. Okay. That was your second hand. Third method. Can you open please? So this is hemostatic sponge. Do you see? So this is also sterile, and you need to cut your shapes. For example, we need to cut like the form of the nasal cavity. Yeah? Okay. If you will put inside the nasal cavity, again through the nose mirror, you are putting the inferior hiatus, putting your second sponge, okay? Third one will be posteriorly, and you will complete, okay? This sponge has some effects. What kind of effects? Yes. There is a lot of liquid as a blood, right? So this sponge has absorption. Look at them. How will they grow? Okay? During the time absorb, okay? And fix all of the nasal holes clear. We need to time to grow. So how does it work?
Yes.
Clear?
Yes.
Okay. Your successfully tamponade will be when? Okay, this splits. This is the nasal splits. When do we use nasal splits? So this is also the form of the nasal cavity, right? Okay. So that will be your deviated septum. After your surgery, to the deviated septum, the patient have to breathe, right? But how? But after the making surgery, you need to put that splits. Okay? It will be looks like this one. And through this tube, the patient can breathe. Okay? Other sides will be tamponed. Okay? Do you understand?
Yes.
So do you see how does it growing?
Yes.
Okay. So look at the picture. We made the similar. This is the anterior. So you need to start from the inferior corner. Through this to the nasopharynx. Yes? And do you see the where started? And where finish it. So you need to make step by step. Okay? If you will block only this side, your tamponade will not be successful. Okay? So look at this picture. This is our tamponade. Was it? We are go to through the oropharynx. We are pulling through the nasopharynx, and we are fixing where?
The
posterior in posterior part of the nasal cavity. Clear? We have also some other methods. This is coagulation. Do you know what is this coagulation? Coagulation. So this is the item electricity. We need to coagulate with the cauterization. So we have the problem zone. You need to find that zone, and you need to burn that place. Clear? And that place will be closed. That Kisselbach plexus will be properly closed. Okay? Okay. So, step to the, if you have questions, you can ask. Yes? In our self-work, and now you can practice if you want in our model how to make, okay? Can you please show the anterior component? Can you repeat my yes, my explanation?
So, according
Okay, practice.
First of all, we have to use spell gloves and ointment like antibiotics on like this gauze cotton spell. And after that, we have to take like
Forceps.
forceps.
By hand forceps. You need to take the bandage with forceps, okay? For Hartman mirror will show yes, just the for the open, okay? Please start.
So we have to first like this.
Just act,
Okay, ma'am.
okay? Fix your nose mirror. Just fix. So how to take second part? Do you have a place? So you need to count that place too.
Yes, ma'am.
Take longer.
So I need to put like this from anterior to posterior and floor to surface to
Again,
floor.
take more. Can you fix the skull, one of you, please? So now we have short time to make practicing, but in real time, everyone yes, have to practice, okay? And after class or in our self-work class also we will make practice. Okay? So now we have some mistakes. We will work by this again, okay? And now please go to the next our task. This is, you need to make some task, okay? Can you have divided, right?
Yes,
This is the first by my list. Yeah?
Yeah.
So, do you know this game? So there is the topics, yeah? And there is what degrees of your task. For example, if you will answer for anatomy 100, you will get 100 for it. Clear? So start.
Ma'am, deviated septum 400.
Deviated septum. Difference between septoplasty and clearance resection. We have already discussed about it. Yeah.
In septoplasty, we have to first of all we have to put one mucosal lining and removal of the side deviated portion which are grown, and in SMR clearance resection we have to remove the cartilage and left anterior and superior region cartilage.
Okay.
and put.
Agree, first team? Do you want to add?
Like ma'am, in Killian's resection, we are basically removing the whole part of the septum. But in the septoplasty, we are only removing the part which have the deviation.
Yes.
So it is more better option.
Let's check your answer. True?
Yes, ma'am. Ready to
Okay,
deliver.
team number one?
Yes.
Okay, counting. Now we can make only 4 rounds. That's why after 4 rounds we will finish. Okay, second team.
After the last 400.
Please taxes 400. What is the cauterization method for epistaxis?
Ma'am, cauterization method we are used for the chemically for the silver nitrate we are used there, ma'am. It is used for the epistaxis for epistaxis are the locations where can be used that. It is first second treatment for the epistaxis where can be used that.
After the Hippocratic method, and we
Why
use
are you
the
answering? Is it your team?
Yes,
Yes,
ma'am, bipolar categorization we use, unipolar is not used in here.
Yeah, we have two types, biochemical, silver electrocoagulation. I showed that pictures, okay? That's true. Your
Management 400.
400, okay, sure. Which drug group is used for nasal decongestion?
Zylometazoline and dilated adrenaline.
Here, you can see the sprays. We are using oxymetazoline, xylometazolene, also. You said about that
Yes, ma'am.
for team number 1, right?
One number.
And another 400.
Hmm?
And
Anatomical
another
function
400.
Okay.
Which is the main.
What is the
Stenopalatine artery for the epistaxis is the main, then the anterior and posterior caudal artery, greater palatine, the facial artery from the superior labial arteries.
Okay, it's branch of which
Ma'am,
main
4 arteries.
Ma'am,
Is it
interior,
external
ma'am,
or
interior
internal?
and anterior and external both. From anterior, it is a ophthalmic artery. From the ophthalmic artery, there is two. The greater palatine and the suprapalatine.
Choose one.
Ma'am, sphenopalatine is the main.
Okay, let's check. Let's, okay. So, you got the... Yes. Oh, sorry. So, let's finish in this, okay? Because we don't have enough time. Go to other presentation. So do you see are you understanding the instruments?
Yes, ma'am.
About head mirror we have discussed last class, you know, yes, mirror, mirror, by forceps and probe by voyage.
Endoscopic,
Yeah.
FES.
Okay, by the end of our class, can you answer for this question? To be a good ENT doctor, what it means? Being a good ENT doctor.
Properly diagnosed.
Okay, to post properly diagnosis. What about you?
Ma'am, to understand the patient and give them the diagnosis that according to his condition.
From the first time, yes?
Yes, ma'am.
Okay.
Being a good ENT doctor means he should have the proper knowledge, anatomical knowledge, and proper the pathology knowledge of the ENT.
Okay. Any opinions?
We can cure the patient without making him any extra trouble because he is facing a lot of problems.
So you need to treat properly.
Yes, ma'am.
Put diagnosis correctly.
Yes.
Take history.
Correct.
Yes, correctly. And treat, by the way, correctly. Treatment depends every time on the causes. Okay?
Yes, sir.
So we start with our goals, and then our class we need to make some resumes. Okay? Did you read all of this?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes? Okay. Can you say which topic did you understand from our class? Which part did you understand properly from our class? You start, please.
Diagnosis method.
Okay, you can put diagnosis. By what? By?
cleaning spectrum and
By the help of the case study and also
Imaging test. Okay, what about you? What did you understand? What can you make after this class? Did you find new information from our class? Yes? What? For example, what can you make? Okay, you can find nosebleed. Okay, what about you?
Techniques of anterior tamponade and posterior tamponade.
Okay, you have know how to make
Yes,
anterior and posterior tamponade. What about you?
We can make a diagnostic about the CT and MRI and how we can do the management of the patient. What will be the first aid management and what will be the secondary management.
What about you?
From this class we able to understand like how can we stop the bleeding and from anterior region and posterior region and the patient to relieve about like both jump from anterior arteries or venous also.
Okay, I want to ask, are you reached all of the goals by today's class?
Yes, ma'am.
Yes, ma'am.
Okay, everything is clear?
Yes, ma'am.
Do you have questions?
No, ma'am.
I have a question. So, give me the tasks. Why, by the way, why I give the, by this screen? Why I didn't put the QR code in screen and you can use your phones, for example, there? Why? Because you are very smart. That's why you can use AI. Yes, but it's not necessary and not good for us. You have to think improve your critical mind. Okay, that's why I give for everyone on the video. Okay, what about the options? Which mark did you put for your write this quickly?
Our student diagnosis was correct, and we also told about the procedure of things, the way first aid.
Correct. Okay. Third one.
Then we also told about the technique of posterior stabilizer.
Okay. And fourth one? And
And
final, which
also-
Yeah, we told you what was.
so which point will be? Four. Okay, what about you?
Fourth.
Four?
Yeah.
What about difference between septoplasty and radical removing by chemia? You couldn't answer.
Yes, ma'am.
What about the fourth question? You couldn't answer mechanisms on the compensatory hypertrophy.
Ma'am, we did the opposite side, the hypertrophy because of the septal divided on the end.
Okay, so you have some argues. Yeah or no? No? So, for your four. Okay, you're putting your points from you, it means four.
Thank you.
But I need to add something. So in your treatment is little bit not correct, so that's why I need to put 0.5. Okay? So this was not properly, not clear answer, not full answer. That's why I need to put take half point. Okay? So this is your home task for the next class. If you don't have questions, yes, write down your home task. Clear? Okay, if you don't have questions, you are free. Everything is clear? Questions? Was maybe some problems? No?
Person will come on my mind and ask him.
If you don't have questions, You are Fi, you are Kimbo.
Thank you,
Okay?
ma'am.
And I'll put points by dividing group for you. Okay?
Thank you, ma'am. Thank you, ma'am.
Did you enjoy class?
Yes, ma'am.
I enjoyed really today. Yıldız, thank you everyone for your participation. You worked very well today and keep studying, improving clinical skills. Well done. Yıldız ma'am, Yıldız ma'am, very good, very best practical teacher. Practical. She is very best doctor too, with good skills, clinical skills. You can be free. Okay, thank you very much.
Thank you, ma'am.
Что обмен опытом, навыков это очень важно для нас, для каждого. Про Джилдыз я хочу сказать, что недавно был опрос, был опрос среди студентов, оказывается, вы не совете, да? Сказали, что многие студенты дали хороший отзыв, отличный отзыв про Джилдыз. То, что именно на нашей кафедре Джилдыз Ханбековна занимает первое место, потому что студенты ее очень любят. И она, вот я сегодня заметила, прям для практических врачей она очень показала очень хорошие навыки тампонады, и не пожалела вот эти как коагуляционные, вот эти, как называется, пластыри, спонжи. Они стоят очень дорого, да. Несмотря на это, она за счет себя, да, за счет своей купила и показала студентам, это стоит тоже многого. Я сегодня действительно получила большое удовольствие. И ваши рекомендации, ваши все мнения мы учтем. Спасибо вам.